Let's talk some more about fighting the pandemic. And joining us right now via Skype is Dr. Abdulaziz Bako, a PhD candidate in the Indiana University. We'd like to thank you for joining us at this time. Let's begin by asking you about the states where you are and how they are battling the spread of COVID-19.
Thank you for having me. I'm in Indiana, Indianapolis, and we are in the stage where we have a lot of cases of COVID-19, and the state is getting ready to reopen, but they will not reopen until they are sure that they have enough testing capacity and also having some research going on about the denominator for the infection, at least knowing the extent of community transmission of the disease. They want to open when all these things are done.
So maybe looking at the angle of politics, the U.S. government, especially the administration of President Trump, has been criticized for slow response. But the president has also ramped up action in recent weeks, easing restrictions on testing vaccines, passing benefit packages for workers, employers. What's your take, and has that had any major impact?
I think it has some impact in terms of sending some palliatives to people who are struggling with hunger and poverty. That was really helpful, and a lot of people, it would help a lot of people because of the massive unemployment that has happened after the start of this pandemic going on in the United States. In terms of the testing capacity, a lot of states are complaining that the federal government is not up to par with the provision of testing capacity for them and some other medical facilities or medical equipment that they really need. And the federal government has not been so much helpful. There's a lot of politics going on there, but I want to stay out of it. I want to just mention that this is what the states are complaining about.
Okay. So let's talk about Nigeria. What's your assessment of how we're handling the pandemic?
So I will say that the federal government has started with some really good measures, but I think there's a lot of things that we have missed. The most important thing that we've missed was our testing capacity. We have not done enough to improve our ability to test people, to identify people that are infected with the disease, to isolate them and identify their contacts and isolate them. When we started this pandemic, our efforts were geared towards building isolation centers, and even the donors that we have been able to bring together. I believe that if they had an idea that testing capacity is a very important strategy that should be used to fight this pandemic, I believe in the beginning of the pandemic, we would have had testing capacity, especially in states with very large population like Kano State. Unfortunately, Kano State got its testing center much, much later into this pandemic.
Now you mentioned Kano. What's your take? Because initially we heard the number of unexplained deaths, and now they're saying that they might indeed be related or they've been attributed to COVID-19, and this is via verbal autopsy. I know you've done some research on that.
Yes, I actually was really concerned right at the start of the pandemic. I was concerned that lack of testing capacity will mean that a lot of people would be infected and we might not know until it is very late. So I was concerned that every time I go to social media, I see people mourning about their deceased persons, and I was concerned. So I started this investigation, asking people who lost their loved ones what happened to them, what are their symptoms. And from what I saw, a lot of people, close to 30 to 40%, have symptoms that are that satisfy the clinical case definition of COVID-19 as defined by the NCDC. And that's really troubling to have. If we have a lot of people with that kind of, those kinds of constellation of symptoms, that is troubling. Another thing that I noticed from the research that I conducted was that a lot of people were not able to go to a hospital. They either go to the hospital and they are sent back, or they go to the hospital and they are not satisfied with the treatment that they have been.
So, Dr. Bako, we appear to have lost a bit of audio there, but according to the center as well, we're hearing that despite the best efforts of state governments, no response measure to controlling COVID-19, that people need to take perhaps responsibility now. Well, what do you think? How much restriction is, in terms of compliance level, are you witnessing in the US? And this is when you compare it to yesterday's scenes of people coming out and not practicing the social distancing and other guidelines to prevent the spread of COVID-19.
So when it started, I think there is massive compliance. The compliance in the United States was spectacular, especially at the beginning of it, when the states were announcing some stay-at-home orders. That was really complied with. Now there's a lot of protest in many states across the United States. So that might be a little violating, but to a large extent, there's a lot of compliance. And if I sort of try to compare what is going on in the United States with what is going on in Nigeria, I will say that a lot of the things that happened are as a result of the government not thinking so much about what will incentivize people to stay at home, what will incentivize people to abide by the stay-at-home orders and the social distancing measures. For example, I'll give a specific example in Kano State. When the stay-at-home order, or the lockdown, as you call it, was announced, there was a day that was given for people to come out, and that day came and everybody came out, and there was a lot of congestion in the whole state. That means that the state have not thought through this fact that when you open the state, this could happen, and there could have been some measures that could have been taken to reduce that kind of compaction and congestion.
All right, we appreciate your time analysis on this issue. Dr. Abdulaziz Bako, PhD candidate, Indiana University. Thank you for joining us.
Thank you very much.